call to order of the July 16th, 2019 LaPorte County Board of Health. Please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, thank you. All right. Roll call.
Dr. Juhas?
Present.
Ellie Vaughn? Here. Dr. Dora?
Here.
Dr. Hout? Michael Sandy?
Here.
Lauren Arnold? Present. Monique Thomas? Here. Michael Mollenauer?
Here.
All right.
All right, everyone. Thank you. Next order of business is the approval of the minutes from August 23rd of 2019, and there is a correction. Julie?
Pardon?
I have a correction. Is that?
Yes.
Okay, we need to put that in now. So the attendance at that time registered initially that Lauren Arnold was present, but then it was corrected that she was absent. Let the record reflect that Lauren Arnold was absent at that meeting, just to make that correction.
But the approval, I'm sorry, Doctor, is for April 23rd, not August.
Did I say August?
It's
Did I really?
Yes. But it's okay.
Okay, April. It's that long with the bridge.
I make a motion that we accept the minutes as corrected from the April 23rd, 2019 meeting.
Second.
All in favor?
Aye.
Anyone opposed? The ayes have it. Okay. Next on the agenda, public comment. Do we have anyone here for public comment? Third time, anyone here for public comment? If not, public comment is closed. Health officers report, please.
Okay. One of the big things, of course, is we still are having issues with measles throughout the country. There's not been much here in Indiana, thank goodness, but it's still increasing, and it is one of the largest outbreaks that's ever been since back in the early 90s. There's been a lot of education and attempt to get people to change their minds to the ones that are to the true anti-vaxxers. I'm really not sure how successful it's being, but it does seem to be slowing a bit from what I understand. So that's one thing. The other thing being is that the CDC has some interesting information again out. It's not really new, but it's for gonorrhea is very drug resistant to most strains of gonorrhea, or many strains of gonorrhea are resistant to at least one drug, so dual coverage has to be done each time. And they're saying down the line is that potentially it will become resistant to all medications. Now that's an article that I was reading from the CDC put out fairly recently, so there was no timeline predicted on that, but it's a rather frightening thought. The other thing they were talking about, there's, of course, it's tick season, and there's apparently been questions about the Lone Star tick, and it will not cause Lyme disease. It's got its own issues, rash, it can be fatigue, headache. I mean, people do not feel well with it, and but it is not the same as Lyme disease. The other thing, again, for people, most important to try and get out to them, if the tick's on them and they know that it's less than 24 hours, they do not need to seek treatment. They don't know, that's a completely different issue, but it takes usually at least 24 hours for a tick to be on you to transfer the bacteria. So I think that's about all I've got to say today.
Thank you, Doctor. Are there any questions for Dr. Ducey in the health report? If not, do I hear a motion to accept?
I move we accept the medical report.
Is there a second? Second. All in favor?
Aye.
No one's opposed. It passes. Thank you. Administrator's report.
Okay, good evening. Personnel, we did have a nurse leave us, Dan Glasgow. She was with us for 5 years. As of July last week was her last day, so right now we're in the interview process of replacing her position. We also have an intern working for us now, Sarah Paxton. She does our beach sampling and everything for us. We only went with one intern this year because the lab was down. We figured we wouldn't be that busy we were busy for a couple months. So she's doing very well at that. The water lab is finally done. It was completed June 10th, but we did run into a few problems. Right now, we were waiting for more equipment to come in. There's still a couple shelvings missed and all that. So with our internet going down and our email going down, we weren't able to have it completed. So it's not complete. It's operating now, but it's not fully done yet. So we're going to postpone the July 26th open house. We're thinking probably sometime early September. Once beach season sampling's over, sometime then we'll have an open house, and everybody board members and councilmen and that will be invited to check out the new lab that we did. We did a little history work on that lab. That lab was started in 1976. I did not know that. So that's how long it's been renovated. So it was due. As you recall, Twin Acres was that subdivision. Mr. Sanchez made a presentation to the board where we would not allow septic permits on that particular lots out there. We had a mediation that Mr. Freeman put together, and it was me, myself, Amanda Nelson, two representatives from the State Department of Health, David Ortel, Mike Metler, and we determined that we would let them put a septic system in, but it would be a type 2 mound without the pre-treatment. And we all agreed on that, so I don't want to get into much detail of what's happening. I don't know if the other two people that own lot 1 or 2 are going to take that, if they'll accept that, or Mr. Sanchez is happy with that resolution. I don't know yet, but I think Mr. Sanchez is, because he did sell his property because somebody did apply for a permit on lot 8, so he must have been happy with what the outcome of what's going on, right? Lot 8.
Lot 9.
Lot 9's the one in question, but lot 8 was.
He sold lot 9.
He sold lot 9 and 8. Yeah. So I don't know what else is going on. I haven't heard. So that's it for my report. Just one more thing is we've been out since July 2nd. The county email and servers were hacked, so we've been operating without email and all our files and all that. So so it's been tough. They finally settled the ransom in the county. Right now, as of today, I heard that hopefully everybody will have email tomorrow. IT's been working really hard getting this going, 16 hours a day trying to get this everything back together. Kind of hard not having computers when everything's on the computers. Everything. So that's my report. Any questions?
Any questions for Mr. Mancuso?
What's the going rate?
Oh, for the ransom? It started at 400 some. That's like 100 and some thousand. That's a Bitcoin. Yeah, it's Bitcoin.
No.
So crazy, but it happens.
I move we accept the report.
Second.
All in favor?
Aye.
Anyone opposed? No. The report is accepted. Nursing supervisor's report.
Okay, we did some off-site testing, and this quarter we did 2 rounds of lead testing for Head Start this last quarter, and we also did some TB testing at the Swanson Center this quarter. As I previously reported last meeting, we were awarded a grant for $10,000 for lead education, and we have distributed lead resource bags to local physicians, community health centers, and pediatricians in our county. And we also have some available to health department that we are distributing to people that utilize us for safe sleep classes, immunizations, and lead testing. We hosted a point of dispensing tabletop drill in May for our preparedness grant requirements. The drill scenario was an anthrax release that happened in LaPorte County that people had to receive prophylaxis for. The drill brought together many agencies to work together on this drill. We did another safe sleep educational tour at the branches of the library. And we like to utilize the libraries to reach people who may utilize them and not the health department. The Child Fatality Review Team just reformed under the direction of the prosecutor. The group examines deaths in people under the age of 18 that are not caused by natural causes. And this allows us to see factors that may be able to be changed that could help protect other children. As Dr. Ducey mentioned, the United States has been experiencing multiple outbreaks of the measles through 28 states. But Indiana has only had one case, and it has not had any further spread from that one case. So it was not in LaPorte County. Indiana is still in the midst of a hepatitis A outbreak. As of June 21st, there have been 1,581 cases. Vaccine is the best way to protect yourself against hepatitis A, so we urge everyone who has not been vaccinated to consider doing so. Any questions?
How much is a hepatitis A vaccination?
Right now it's $58, I believe, per dose for adults.
Any other questions? Jennifer, thank you very much. Is there a motion to accept the nursing supervisor's report?
I make a motion we accept the
Second?
report.
Anyone? Do I hear a second?
Second.
All in favor?
Aye.
Thank you. Nursing supervisor report is accepted. Environmental health and food supervisor's report.
Good afternoon.
Good afternoon.
The environmental division, second quarter of the year, is always the fun part because we get the intern, we get new blood, and somebody new to break up the day. Sarah Paxton is her first summer with us. Hopefully she'll come back again. She is a graduate of New Prairie High School, and she'll be starting her third year college. She's transferring to IUSB, and she's actually goes to orientation tomorrow. And then we also have two new clerical. If you remember, Christine Happel was able to move into inspector position, which opened up a spot up front. And then we also had somebody take a position over in the Michigan City office, or in Michigan City at a different office. So we had two openings. So Adrian Bradley and Lindsay Cole were able to fill those positions, and they've been in about 5-6 weeks now, and they're filling in great. Both very professional, very smart, and they've fit in great with us. So the fourth year in a row, we did our bake sale this past April for the Worthy Women's Recovery Home, and we won the trophy again this year for the most donations. We raised, from just our bake sale, we raised $1,078, which we gave all to them. And I participated, and I should say we all did, at the Michigan City Conference on the Environment. It's the 8th annual conference. It's something that they do every year. The city host. It's organized by Mike Cuss, who runs the sanitary district, and it's free to anybody to attend. They hold it at Blue Chip every year, and they always try to bring in a keynote speaker. This year it was Captain David Rierick, and he is from Michigan City, and in 2013 he circumvented the globe on a solo sailing mission. It took him 8.5 months to do that, and I'm a semi-social introvert, and I like myself, and I'm happy with my own company, but I don't know if I could do 8.5 months solo. You gotta talk to somebody in that amount of time, but he seemed like he was still all there, so. And we asked to give a presentation about the Governor's Award. Again, that's okay. I got it down pretty good now. If you remember, Northwest Indiana, out of the 7 Governor's Awards that were given out last year, 4 of them were from Northwest Indiana. So all 4 recipients gave a brief presentation. Of course, we got our IDEM contract again to sample Lake Michigan along those 4-5 same stops. We were awarded $8,135.60, which won't be our final amount. We still had in there stop 24, just in case something miraculous happened and we're able to start sampling again, but that hasn't. So I'll have to update you what the final amount is that we will get reimbursed for. Things things changed a little bit on Lake Michigan, and it's all over northwest Indiana. We're not the only area suffering from it, but the beach is just being washed away. And they're having, where you've had hundreds of feet of beach to almost no beach at all. So from Hammond all the way through to Michigan City. We've lost stop 37. We're not able to sample that this year because it's just a straight drop out to it. It's just not safe. I don't want somebody go out with our intern and throw a rope over the sand dune so they can sample 37. You shouldn't be swimming out there anyway because it's not safe. Stop 34, there was a couple of days we weren't able to sample for the same reason. After a storm came through, there was a good 10-foot drop from the dune down to the water. Not safe. Stop 24 is still closed. IDEM decided to go ahead and start sampling at stop 14. We'll be getting a post up there, or I should say IDEM will be getting a sign put up there so we can put up the results, whether it's advisory or not. That didn't start until June 26th was the first day of sampling at stop 14. So that'll be a new stop for us. We've never stopped at that area. We don't have any historical data for that stop, but we'll do it for a couple years. We'll do it as long as IDEM wants it done. It's their contract, so. But everything else we started on May 20th while the lab was closed. We were able to work with the City of Michigan City Sanitary District to run our samples for us. And then once the lab was up and running again, we started doing them on June 11th. And that's when we started doing inland samples. And the inland samples are done twice a week, Tuesdays and Thursdays. And in Lake Michigan, Monday, Wednesdays, and Fridays. There's a number of new establishments. I'm happy to report that Popeyes is open. And it is super busy, and we've already received our first complaints, but that must be mean they're doing good. May was Drinking Water Week. We celebrate it every year. It's usually the first full week of the month is the National Drinking Water Week, and we extend that to make it National Drinking Water Month. Instead of offering samples for just a week, we do it for the whole month. And this is our show and tell portion of tonight's presentation. I included or handed out the test kit that we hand out, and we have for the last couple of years. Everybody seems to really like these kits. They test for 10 different items. They're listed on the back. And they are more or less instant testing or within 10-15 minutes, except for the bacteria test that has to sit for 48 hours before you get a reading. And people like this because they can take it home and they can do it at their leisure. They don't have to do it right away. They don't have to bring anything back to us. They don't have to submit anything back to us. And when we used to do, and we might again in the future, offer them the bacteria test or nitrate, the problem with that is you have to take it home and you can only bring it back at certain times. We only have that, the lab can only come back between Monday through Thursdays, and that's always been seemed the breaking point of actually getting anything back. But we gave over 225 kits away between both the LaPorte and Michigan City office. Lyme testing continues to be semi-popular. Again, we're the only health department that offers that. We're not doing the testing, but we do the blood draw free of charge. And then the patient submits whatever testing they want to have done, just Lyme, or if they want to do the whole panel of testing, gets sent off to a laboratory in California. So we're just acting as a facilitator for that. So of the 6 testing that we were able to do, one person came back as positive Lyme disease. And the testing is, I think it's up to $235 now to do the Lyme panel out of pocket. And you don't have to have insurance to get that done. If you tried to go to the hospital to have that testing done, it would be over $1,000. So some of this is just a peace of mind, and they're able to get that testing done.
Is it a prescription item, though? You have to have a prescription from a
we do.
Healthcare provider?
Yes, Dr. Ducey acts as that. And it's not for treatment, it's just for you to be able to have that testing done and you know your results. and then for them to take those results to their physician to seek treatment if it's proper or needed. So in the same category, the Northwest chapter of the Indiana Environmental Health Association, which I am still currently Environmental Health Specialist of the Year with. Tony is so ready for this to be over with. But our Northwest chapter, we have quarterly meetings, and at our quarterly meeting this year this past quarterly meeting, Lee Green, who's our field entomologist for this area, came in and gave us a talk and our brief training on Lyme disease or on tick-borne illnesses. And Lyme is increasing in the area. They finally just got a grant to do tick testing. The grant is through CDC though, so we have to send everything through the CDC to be tested, and the turnaround time's not so quick. So he's got like a 4-month backlog before getting any of the results back for tick testing. But they're seeing a higher amount of Rocky Mountain spotted fever in Indiana, and not being travel acquired, but actually people having not traveled but being in Indiana and acquiring it. That one's a little more alarming. Rocky Mountain spotted fever can be fatal in some cases. And he said they're also starting to see more of the meat allergy, which I thought was kind of interesting. That's from the Lone Star tick.
Texas.
So I've included also a tick key for you. You can just put it on your keychain, put it on the dog's leash when you're out walking or whatever, because it works great for your pets also. And a little guide.
These are wonderful.
Yeah.
They really
You
work.
use it with your dogs and on yourself.
Cats, dogs,
Cats. People.
Big season for ticks.
It is.
A lot of rain, whatever they like.
Yes.
And they're out there.
Yes, and especially up in Northwest Indiana, you have to have a hard freeze. And you have to have a hard freeze to kill them off. But we have all these oak forests and oak trees up here if they're out in that oak litter, either you're not going to get that hard freeze, so they'll be active year-round, and you never get that die-off. So they are really bad up in this area.
Is it true that they don't like light clothing? Like if you wear white socks? They don't care.
No.
Yeah, I know. They're out there.
They're easier to find, though, if you're wearing white clothing.
They're out there waiting.
Yeah. They are. They're holding on with their back legs, and they're reaching out for it.
Yeah.
Okay, I'm sorry. I'll rein it in a little bit.
This is fabulous. Thank you.
Yeah, so does anybody have any questions?
Yeah, let's talk about the fair. Weather affect anything out there food-wise? We had no problems?
No, actually, we were a little concerned. Like the first day after doing inspections, we're like, wow, everybody's really kind of got it together. It was a really good year for the fair. There was only 1 or 2 units that had to be continually checked, but everybody else that really had it pulled together. So it was a nice year for the fair.
Good.
Yeah. Yeah, and one of the units we've had problems with in the past was not invited back this year, so that was nice for the fair to take into account, the fair board. Yes, everything is hooked up to city water and sewer. No wells out
Yeah,
there.
you didn't have to worry about the wells.
We didn't have to do any testing.
Good. Any other questions for Amanda? Do I hear a motion to accept the report?
I so moved.
Second, anyone?
Second.
All in favor?
Aye.
Okay, the report is accepted. Thank you very much, Amanda. Health educators report, please.
Okay, so this is my second time here. I'm still getting used to what the information that you want to hear. So if there's anything, and I apologize, the report didn't get to you before tonight. So I did a Narcan training for Cambridge Square Apartments, and the people that work there, they work as case managers for all the people that live there. In essence, that's what when you think of people that are helping people, social workers, they act as case managers. They help the people do anything and everything that they need. They provide services for them. They help to get them to services. So I'm actually considering training them as trainers because they're the ones that are with these people all the time. So if they can train those people that need the Narcan, then I think that would be a good thing. So because they came from all over. It was Gene B. Glick apartments properties, so he's got properties everywhere. So there was, I don't know, maybe 20 people there, and there was a lot of people that couldn't come that day, so I'm going to go back and do it again for them. So I just trained them to carry the Narcan. We did a mental health preparedness fair at the Pleasant Missionary Baptist Church, which was really good. They're starting to do more mental health awareness fairs in Michigan City, and they always do really well because that's such a hot topic right now for people to be mindful of the mindfulness that people need, the toxic stress that kids go through, and traumatic experiences that is the deep-rooted cause usually of opioid addictions. There was 2 newborn baby classes held by the South Shore Skipping Stones. Was not very well attended, but very good intentioned. There was like 5 doctors in the room that people could take advantage of. So I think Skipping Stones is a new organization, so I think they're going to realize that they have to hook onto other events and not try to put on one themselves. That's what I've found. I have to piggyback on other events in order to see the volume of people that I would like to see at an event. So it was really great. The people there were really appreciative of the car seat information that I was able to give to them. And they had lots of questions, and I took up way too much time, and the chiropractor that was behind me was very mad because then she didn't get to have as much time because someone had to leave. So also we started doing the Narcan distribution with the Michigan City Fire Department. They were getting their Narcan from LaPorte Hospital because they get it from them for free. But LaPorte Hospital has these crazy protocols that they haven't caught up with the distribution, the easily distributed Narcan now. So they came to me and asked if they could get it from me, and that particular batch there was no requirement for. The only requirement that I have for the Michigan City Police Department, Community Corrections, Coroner, and EMS is that they have to turn in a little postcard when they use it, and it goes down to IU in Indianapolis, and they do our data for us. So anytime you receive that free money, you have to do some kind of reporting, and that's the only reporting that they ask for is the demographic information on the postcard after you use it. And for some reason, this last batch, it's all on where they get the money from. So the money that they gave me for that batch didn't come from the original grant money that they got from the feds. So they didn't have to, they weren't required to turn in the postcards for that batch. We did have a request from volunteer fire department, which I've been trying for over a year to get them to carry because they had made the decision. Some of them don't, some of them do. So we do have one that has come around and asked for Narcan from me. They've all been trained by EMS to use it, they just don't carry it. So I'm hoping to get the rest of the volunteer fire departments on board and doing it. So we had to reapply because they have to do the EMS protocol for LaPorte County, which is the 2 milligrams in the 2 milliliter solution. What I'm giving to lay people is a 4 milligram. So I have to do a special request for that. And since this year we didn't apply for any more Narcan because I have 500 doses in my cubicle I can't get rid of. But since I needed this special dosing, the protocol, I had to go ahead and apply for another grant this year to get them their doses.
Any questions? No questions? Thank you very much. Motion to accept the report. Second? Second. All in favor?
Aye.
No nays? Report is accepted again. Thank you. Attorney's report?
Good afternoon. I don't have anything to report, but I will piggyback off of what Tony was reporting regarding the mediation in Twin Acres. We had that mediation, and it was very productive. We took advantage of the fact that all parties were involved. Everyone that has any interest in Twin Acres was there, and we had state representation too to help us sort out some of the issues. And because there's still pending litigation, we won't get into details in this public meeting. But what I can assure the board is that we're working to resolve each of the parcels in question. If you recall, Mr. Sanchez isn't a part of that litigation, but he was invited to the mediation to try to have a global resolution of all of the problems. And I think it's working. We still have to come up with a settlement agreement with some of the other parcels, but we're working towards that, and I think that will happen, and that the litigation that's pending regarding all of that will be resolved because of the mediation that we had.
Any questions? Is there a motion to accept the report?
So moved.
Second?
I'll second.
All in favor?
Aye.
Anyone opposed? No. Thank you very much. The report is accepted. Is there any old business that we need to go over? Anyone? I don't have anything. Any new business that anyone would like to go over? I do not. Yes.
Yeah, I'd like to ask Mike, being our representative of the county council, have you guys started any budget talks? Is it too early for that?
No, Monday.
Monday? Okay. Guess you're gonna get in there, get our guys a raise. So, gotta throw that.
Go Monday. Go Thursday.
That's all I had.
What was that about? What raise?
For county employees.
So that would affect all the employees.
Okay.
Okay. All right. I just didn't know what we were talking
We
about.
like all a raise.
The what?
We would like all a raise. Everybody in the county would like a raise. But
Yeah.
the council.
All right. Well, we'll keep our ear out to what the council. All right. Thank you. Any other new business? If not, the meeting is adjourned.
Next.
And next meeting is
Next meeting, got a date?
August 22nd. Pardon?
Your
October 22nd.